If you ever think of buying good quality meat at unbeatable price, think Majilac Butchers, your only suitable solution for quality meat for you and your family consumption. Our comprehensive range of meat products include minced meat, beef slices, top side, knuckle, rump steak, silver side, tenderloin, strip loin, and forequarter. We offer consistent value, quality, and service through animals grass-fed and bred, especially for their meat. This makes the meat much more tasty, succulent, tender, and easy to cook. All meats at Majilac Butchers are halal, including for the first time in the Gambia, the new Mongolian whole lamb, available only at Majilac Butchers. Rush now and visit Majilac Butchers on Caraba Avenue, opposite the Petrogas petrol station traffic lights. For inquiries and orders, please call 7688-688. That is 7688-688. Majilac Butchers, the home of quality meat and chicken products at unbeatable prices.
Good afternoon to all of you. Good afternoon, Honorable Samateh and Honorable Mambury and Njie. You know, today we have two ministers here. That shows the collaboration that we have been promoting and we're talking about. Today you will see the two ministers of health and finance to be talking to you and giving an update as to what we are doing with regards to COVID-19. So I now have the honor to invite Honorable Samateh to deliver his statement to the press. Honorable, welcome. You need the word. Okay?
Thank you very much, Mr. Njie. Thank you very much. Good afternoon to you all. The 27th National Situation Report since confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia on the 17th March 2020. Today marks exactly 1 month when the country reported the first case of COVID-19. Since then, the Ministry of Health has been working with partners to identify or to intensify COVID-19 response, and amongst the many responses and amongst the many achievements are the following. 9 laboratory test results were recently received. 8 of the samples tested negative. 1 of them is the result of a repeat test of the fourth positive case, and this test has come out inconclusive. 5 additional people were taken into quarantine. 2 of these are Gambian military officers who came back from travel recently. 1 is a Senegalese national who was intercepted at the Djibouti border post whilst trying to sneak into the country, and 2 are Gambian Quranic students coming from Senegal. With the brief lull so far in the reporting of new confirmed cases, there is a significant reduction in the number of calls to the 1025 hotline. Currently, the country has 6 active cases and no probable case. Just as a reminder, globally, since 31st December 2019, and as at 16th April 2020, a total of over 2,193,000 cases of COVID-19 have been confirmed so far. Of these, there have been well over 140,000 deaths, getting close to 150,000 deaths. There were over 550,000 recoveries. Senegal has so far recorded 335 confirmed cases, 194 recoveries, and 2 deaths so far. Currently, we have 72 people in quarantine. A total of 316 tests were conducted. Out of those, 9 were positive. 254 people completed quarantine. 241 contacts have been traced, and 310 people completed follow-up. There has been daily coordination meetings which are ongoing at both the strategic and technical levels to coordinate and implement our strategies for the response against COVID-19. The Ministry of Health is intensifying testing for the coronavirus in the country. Various communities and people in high-risk areas will be tested going forward. Individuals are equally encouraged to come forward to be tested. There has been increasing evidence that the use of the face mask has proven to be beneficial in the prevention of the spread of COVID-19. Countries in which the use of the face mask is widespread have had lower number of COVID-19 cases so far. This has gone to strengthen our conviction that in the Gambia, where the number of cases is low, the use of the face mask will help to protect both the wearer and the people around from infection with coronavirus. We therefore strongly recommend the use of the face mask for everyone going outdoors. The Ministry of Health encourages the use of locally made face masks for the general public since the surgical face masks are not readily available. Locally made face masks have proven to be effective, and as such we encourage the general public to regularly wash these locally made reusable face masks and to handle them with clean hands to avoid contamination. We hope to demonstrate this to you very soon after the Honorable Minister of Finance's statement, and after the question and answer session, we'll demonstrate and show our encouragement for the use of the face masks in this country. We thank you very much for your kind attention. Thank you.
Thank you, Honorable Samateh. I now invite Honorable Mambury Njie, the Minister of Finance and Economic Affairs, to also give a statement.
I thank you very much, Mr. MC. Good afternoon to you all. This is the first time we are appearing. We hope that every week we will come to the press and update you on the finances of COVID-19. Everybody is aware that the President did approve 500 million specifically for financing COVID-19. Prior to that, we released 12 million. That was the immediate release just to make sure we respond to COVID-19. As at now, April 16, we have spent 143 million. The 43 million was spent here in the Gambia, and it includes, the expenditure includes hotel, food for quarantine patients, purchase of various medical consumables. The balance as at now, out of the 512 million that we have spent, as of April 16, 512 is 368 million. 0.7. That's the balance. Now, I think it is very important for me to clarify that up to this morning, every dalasi or butut spent on COVID-19 is from our local funds. Not a single dollar or penny has reached the source of Gambia. Yes, it is true that the IMF did approve on March 23rd a financing for balance of payment support of $47.1 million US dollars. And this for $47.1 million is specifically for balance of payment support. It's the augmentation of our reserves, just in case we have a deficit so that they'll be able to fill the gap. That was the approval on March 23rd, 2020, meaning those funds will not be remitted to the coffers of the government of the Gambia. April 15, the IMF did. The first approval is called the Extended Credit Facility, ECF. The second one on April 15 is 21.3 million US dollars. That is under the rapid credit facilities. How does this facility work? It will be sent to the central bank, and the central bank will on lend. They will denominate it in dollars, and it will be on lend to the government of the Gambia. But all of these funds, up to this morning, did not reach the source of the Gambia. So just for clarification, it's been approved, but not yet dispersed. It is in the process. But the one that will reach the Gambia is the 21.3 million, and this is the update. Let me go back to the local funds. The Minister of Health and I constituted a committee comprising of the Permanent Secretary, Minister of Finance, Permanent Secretary, Minister of Health, Director General, Public Procurement Authority, Director Internal Audit, the Accountant General, I believe, and there's a committee, very strong committee, that will vet every submission or request being made for the expenses to cover COVID-19. We have delegated them the responsibilities. So just to make sure that the process is expedited. So remember, every amount spent, the 43.3 million is local expenses. The $100 million that we also, that we spent is to supplement the World Bank 10 million US dollars. That it's a grant, but there was a deficit financing of $2 million. That is for the purchase of medical equipment and consumables. So there was a deficit of $2 million. So out of this 512 million, we took $100 million. Now it is now $12 million, $10 million from the World Bank, $2 million from our local sources. So just to re-emphasize the fact that up to this minute, we haven't received any money from outside. Basically, that's the update. And so far, I think I have covered everything, Honorable Minister, and I'll be available for any question and answers.
Thank you, Honorable Mambury Njie, for that update on financial matters related to COVID. I now invite Abubakar Sankano to facilitate the question and answer session. Sankano.
Thank you very much, Director of Public Health Education and Promotion, Mr. Njie. Thank you very much, Honorable Minister Dr. Samateh, Honorable Minister of Finance, Mambury Njie. It is indeed a sigh of relief for you to be here, because we in the front line, we are tired of this 500 million. Thank God, for helping. And Honorable Minister, it's 1 month, as you say, but hyperbolically it has been like 1 billion years. But 1 month of disruption in our social lives. Thank you all, ladies and gentlemen of the COVID-19 Media Corps. The floor is open. Your name, media organization, and one question, and to whom the question is directed, please.
Just a quick one to finish with you is we want to know also, as a media, who is responsible for communicating with the media on regards to this COVID-19 problem, so that we can minimize the risk of taking chances of misinformation, especially with regards to press conferences and other information that's right. Can I just ask you?
Maybe when we finish, so that he can come to the podium. All right. Yes. Thank you very much. Of course, the Gambia has registered 9 cases for now. That's why we keep on emphasizing that we should not be complacent. We have seen the trend in other countries. Now, this is a new disease. Based on the pattern of epidemics, based on the pattern of this disease, how it manifested in China and how it is manifesting in the other Western countries. Based on those, there have been various models devised by various expert groups that have been used to make projections. So those high figures are based on those projections. So whether that will happen or not, really, only Allah knows. But the point is that when those projections are made from what prevails elsewhere and what prevailed elsewhere in other countries, in China, how the pattern of the epidemic in China and the current pattern of the pandemic, I think the important thing is to brace for the worst. That is the response. We brace for the worst, so that we strengthen our systems, we train people, we put forward, strategies to be able to deal with that when we get those cases. Certainly, whether Gambia will be able to deal with that or not, our health system is weak. So we pray we don't get 100,000 infections. But when it talks about 100,000 infections, that is the overall number of infections. But not even all those will be symptomatic. You know that they said 80% usually symptomatic. 20% are symptomatic, 80 are asymptomatic. But even with that, it is a huge quantity. Now, the projection also went ahead to say at the peak, if it should reach the peak in the Gambia, we expect 3,000 hospitalizations. That is a huge number. That's a very large number. But in the current scheme of things, we trying to get as many as 1,000 hospital beds ready just for the emergency, and then of course increase the numbers as and when we need them. So they are going to be quickly built. Some are going to be makeshift, but for the time being, we are putting up some permanent structures quickly to be able to deal with them. And we are mobilizing the equipment. The Minister of Finance just mentioned that the equipment are coming very soon. So we are getting prepared. We are not complacent. The fact that we've had 9 cases is not stopping us from strengthening our plans. Now, but we also appeal to the general public not to be complacent. Many countries started that way. They had few cases and they had a quiet period, and then they had the explosion. But because we have a few cases, people think now COVID is not a reality, so we have to be very vigilant and make sure that we continue the strategies, the hand washing, the sensitization will continue, but we urge the general public to intensify their efforts in the preventive strategies. Thank you. Yes, we have a health promotion unit. I guess we've been dealing with them. They are the responsible team. There is a team, a very good team, that are supposed to deal with you with regards to communication issues. And I'm sure some of you have gotten their contact numbers, but they should make that available. So if you want information, the correct information, you contact them, they will give you the correct information. I think that is the route of communication. Other than that, it can become questionable. Yeah, thank you.
Question for the
Yeah. Yeah. Okay. So, yes, I could be there. Yeah. Yes. Yeah.
Money is yet to arrive in Uganda, even if it's saying worldwide norm. May I ask, when is this money arrive? All that is mentioned in the name of Uganda, when are you going to get it? And the second part of the question, we know now from our reporting, daily report, we realize that people are definitely complaining about food insecurity and fear of being locked down for so long. Now we are talking about state of emergency for 45 days. So what is government doing right now to mitigate the effects that people are complaining about right now? Immediate effect.
Thank you very much. The monies from the partners, our wish was that it arrived yesterday, not even today. They have a process, and we hope that we will be able to get it ASAP. But again, I said the 47 million is not something that will come in fiscally to us. It is something that will be lodged just for balance of payment support. The 21 million, we hope that by the end of the month we should be able to, because the approval was just on the 15th. Again, everything is linked to our own good macroeconomic performance. With respect to assisting Gambians, I think this is the responsibility of the government of the Gambia, and data has been gathered. What happened now is the data that we have, the household survey data that we have, this is pre-coronavirus. If we base our distribution to the most vulnerable, this has shifted. Even us in the urban area now, you and I are also vulnerable because it depends on the type of vulnerability. So there is pre-corona and post-corona vulnerability. So the data that we are gathering, it will be based, we have to be guided by a data. That is why the committee, the cabinet committee that is chaired by the vice president has been working hard, almost 7 days a week, to ensure that the data we gather will be able to guide us in the distribution. So they were at a very advanced stage, and all the necessary details and information will come to you as soon as we are ready. But the assistance is guaranteed, and we are coming. Yeah. I think there is just few days ago, a project manager, of which it will be announced later, has been appointed to work with the Ministry of Health. We know that there are a lot of activities going on. With us, for government, any donation that is coming will be housed under the custody of the Accountant General. We are not touching that yet because we have not, until we exhaust the 512 million, then we will not go that, we will not touch that money. In terms of coordination, yes, at the beginning there were little hitches, but as at now, there is very good, effective coordination with our development partners, including the ACSOs and everybody, civil society, and these are things that are going on, and we hope that everybody, it's all inclusive. In terms of coordination now, we are well set and we are moving towards the right direction.
Thank you very much. You lady?
My name is Fatou and I am from Gambia Finance. Well, my question goes out to Honorable Minister of Finance. As we've seen earlier last week, you've seen you and the Vice President, together with the Vice President and other top government officials, receiving a dummy check of $12 million from AFICEL as their contribution towards the fight against COVID-19. Sorry, in the video circulating and picture circulating on social media, you guys did not observe social distancing at all. You guys were seen together, shoulder to shoulder, right next to each other. So what can you tell, or how do you expect Gambians to take the social distancing seriously when you guys are not observing it yourselves?
Thank you. I guess because the Minister of Health was not there to guide us. But on a more serious note, it was a big error, and we accept responsibility, and you will not see that happen again. It was a big error.
Thank you very much, Amadou Barry. I work for Star TV and for international media in Senegal. I have two questions. The first one is close to the Minister of Finance. As we have said, the two times Gambia has received money from IMF, and the moratorium also has been taken for developing countries. And knowing that Gambia, the debt of the country is almost 120%, some say 130% of the GDP. I would like to know your reaction as a finance minister to that. What is, the impact of that one for the country? And the second one, we have always seen in Africa, like our neighbors in Senegal, they are taking like social media help needy helping companies that are really affected by this pandemic, and in the country they are used to receive that one, and many businesses have closed space. What can you tell them? This maybe possible for the people that are most affected by the pandemic. And also maybe the last question is to the health minister for the prisoners or inmates. We have seen elsewhere across Africa, the government are taking measures to release prisoners, in order to avoid any case there in the prisons, because we know that only one case there would be a catastrophic event. I would like to know maybe any expectation from the Gambian government. If possible, I would like it in the Wolof also.
Oh, now you are testing me. Okay, thank you very much for clarification. I think this is why we saw the need to be coming to the media. We are not very good at that. We are so much focused on our work. The 129% you were saying, yes, but that is history. We've worked so hard, now it has gone way down to almost 82%. So that is a significant performance, meaning that because of our good macroeconomic performance, I think there is a response from the donors. But let me also clarify, there is a difference between debt relief and debt cancellation. What we have is debt relief, meaning that you don't have to pay your debt now. We will push it maybe in the next 3-5 years. That's what it means. It's not a debt cancellation. So it is something that we welcome and is a big relief. And because of that fiscal space we have, we've been able to mobilize this 512 million so that we can spend it. if we did not have that fiscal space, if it was during the time of 120% to GDP debt, we are tight. But today we are proud and very happy to demonstrate that we are committed and we are using our own local resources. 512 million in our own local situation is not small money. So because we perform well, because of our fiscal discipline, we're able to really respond immediately to the request for COVID-19. And your other question is about to assure. Yes, the Ministry of Trade and Investment, that is the private sector ministry, they are working very closely with the private sector in order to be able to help the small and medium-sized, to be able to help all businesses in the Gambia that have been affected. And the package, I'm sure the ministry will recommend a very good package that will ease the pressure on the businesses. Work is ongoing. Yeah, but let me also explain to you that this is a private sector thing. We cannot go overnight to the bank and dictate. We have to review based on the data, based on the justification. Because at the end of the day, the contingent liability rests on government. So when we go to a commercial bank who was making a lot of profit, we cannot dictate. There are policies and regulations that will guide our action. So this is why it needs a very careful, we know the pressure is on. And we know these are the good taxpayers. And we know that if we don't help them, everything will collapse. And we intend in a very positive way to help them. And I must confess now to recognize the contribution from the diaspora. I have been receiving very excellent concept papers and notes from them. And I think this is what we expect from Gambians. You are giving us something that we are now putting together, and I salute them because all the information they are giving us, you cannot find it anywhere in the internet. And that means that trust, that partnership is there. That I must salute those Gambians in the diaspora, even locally, but the diasporans' response, really, I call it their intellectual capital. They have invested, and we salute them for that. Mbokk yi li ma mun a wax rek mooy ne bi Corona 19 doore fi ba tey jéego yi nga xam ne président Barrow def na ko bari na torop bari na ndiglan lim si itteel mooy li nga xam ne moom lañ soxla si garab ni ma ko mun a waxee rek bañ dooree 512 million moom lañ teg ne lii pour jënd ay garab ak ay machines yoo xam ne dinañ ko mun a fajee ñi nga xam ne daf leen feebar bi daf leen dab ak ñi nga xam ne feebar bi dabut leen so si yooyu lañ nekk président bi loo xam ne lu déggu la si moom te li nga xam ne tam moo xam ne moo ko war moom as kilifa réew bi moo ngi koo def xaalis boo xam ne jat na ko pour wér gu yarami Gambia moom jaral na ko lu nekk so si tànka boobu la nekk te ñun Minister of Health ak man Minister of Finance digal nañu ne loole mbooleem luñ mun a def loo xam ne dinañ mun a dimbale wér gu yarami Gambie ñi nga xam ne sax ñoom la gën a lifin ñi néew doole ñi ñooñu la ñu dee wax ne ñu bàyyi xel ñi néew doole ñi soo si loolu lañ nekk ñu ñàkk seen liggéey yooyu yëpp mu ne moom Gambie yëpp la ak ñi nga xam ne nekkuñ Gambien sax te ñu ngi fi dëkka ñooñu si njabootam gi lañ bokka so suy wax su ne Gambien ak ñi nga xam ne ñoo fi dëkka because am na ñoo xam ne dëkk nañ fi ay ñeneen fukki at juróom fukki at seen doom yi fii lañ magee ñooñu doo leen mën a wax ne nekkuñ Gambien so mbooleem koo xam ne dëkk na fi waaye in particular Gambien si laa wax ñooñu mën nga leen a ooyee Gambien waaye lifin boobu la ñu jox instruction boobu maay ministre baa ngi nii toog amul samedi amul dimanche guddi bëccëg suba daf ñoo woo fan ngeen toolu naka ngeen defee dimbale leen nit ñi dimbale leen ñu néew doole ñu néew doole ñu nag ñi nga xam ne ñu néew doole ñu ngi fii ñu ngi si dex gi fuñ munti nekk rek ñoo xam ne ñooñu la war a njëkkaa nibal bi njëkkaa war a jot mun naa laa wax ne nag sori nañ si lool
Thank you very much. you did mention the issue of the prisoners. Yeah. Yes, an infectious disease in a confined space can spread very widely, affecting a large number of people within a very short period. And the Ministry of Health is aware of that, and discussions have taken place. And the authorities are aware, and they have done preliminary assessment. Not to preempt any action on that, will allow the relevant authorities in that case to answer that question, because irrespective of how good we want to, whatever good we want to do, it has to follow the prescribed procedure. The prisoner issue, also there are procedural matters that need to be followed so that the good thing is done in a right way. So the relevant authorities will talk about those. When you get the chance, you direct the question to them. You get the answer. Thank you very much.
Question for the day, or three more questions, yes, and then the lady from the will start.
According to the female immigration officer, undergoing treatment right now, she was quarantined and then later been released. During her release, she went on her normal businesses. She went to the market, she did her laundry, and also she did anything that she said that she was doing on her normal basis. When she was back at the community. So how far are you guys with the tracing of the people that she got contacted?
So the contact team is working very hard and following up, getting the details. Every day they go around to talk to the relevant people, to look at all the possible contacts, and they enlist them and do the relevant actions that take the relevant actions that need to be taken, including lab tests where required. So they are doing what they need to do. But as I mentioned earlier, the last time, with diseases, especially new diseases, people follow protocol of management, and those protocols are designed or developed by expert committees. And the protocols themselves change from time to time based on the new evidence, based on new information, and based on a host of other points, like the way the disease is spreading, which people is it affecting, and so on and so forth. Now, the protocol then was people who had undergone quarantine for 14 days, if they were asymptomatic, they don't show the signs or symptoms,